Hello, good morning. My name is Dr. G. Ram Mohan. I am a senior consultant pain management specialist at Yashoda Hospital, Hyderabad. I am the director of acute, chronic, and cancer pain services. I have always been committed to providing comprehensive, cost-effective, evidence-based, non-surgical solutions to a wide variety of complex, difficult pain problems. Pain is one of the most common reasons why patients visit doctors across the world. Pain is very important for human survival. Pain is like an alarm system of the body. It alerts our body to the presence of tissue injury. It also prevents further harm to the tissue during the healing process. Pain is generally classified as acute or chronic depending upon the duration of the pain. Acute pain is further classified as nociceptive pain and neuropathic pain. Nociceptive pain is due to injury to the skin, the muscles, the bones, ligaments, and the joints. Neuropathic pain is due to injury to the nerves. Acute pain is usually self-limiting, and the pain tends to improve as the healing is progressing. It usually does not last beyond 3 months of time because this is usually the time frame where most of the tissue healing would have happened. Examples of acute pain include muscle sprains, fractures, angina pain. Even surgical pain is classified as acute pain. Acute pain can be treated with conservative methods, and this includes rest, icing, compression therapy, elevation therapy, and if the pain is a bit more intense, you could try painkillers. And if the pain is really intense, you could try stronger painkillers which can be injected as well. Chronic pain is very different from acute pain. In chronic pain, pain usually lasts beyond 3 months of time, and the pain usually persists even after the original tissue injury has healed. The problem with chronic pain is with the nervous system. The abnormally sensitive nerves keep sending pain signals to the brain even in the absence of tissue injury, and most of the patients with chronic pain are in constant pain throughout the day, most of the nights too. Chronic pain cannot be managed like acute pain. Chronic pain is very different. Chronic pain patients have constant pain. One thing which is constant in their life is pain, although the intensity of pain can vary from time to time. There are days, good days, where the pain intensity is less and they'll be able to get on with their day-to-day activities without much discomfort. And there are other days where the pain is so intense that even getting out of bed will become a big problem for the patients. To achieve 100% pain relief, like I said, is almost impossible. So how do we basically deal with the patients? The goal of the treatment is to minimize the pain, improve the functional mobility of the patients, and to improve the overall quality of their life. This cannot be achieved with painkillers alone, although most of these patients would require painkillers on a regular basis. What works for this patient is a multidisciplinary approach. This includes pain specialists. It also includes physiotherapists who will teach and train the patients with gentle exercises. Complementary therapies are very useful in chronic pain. These include yoga, meditation, tai chi, hypnotherapy. Psychological support is again very important. There is a particular therapy which is called cognitive behavioral therapy, which works quite well for these patients. Most importantly, it is how the patient is cared for is very important. The patient knows that she is in pain. It is also important for the patient's carers, which includes the family, friends, to understand that chronic pain is an issue. She is not faking the pain. It is part of her life. All she needs is that you understand that she or he is in pain, and they usually fare well with it. If they don't get this support, they'll get psychologically very depressed, which will lead to suicidal thoughts. When would you want to see a specialist is when your pain doesn't subside on its own. It has been a few weeks since the start of your pain. If the pain is nagging and it is affecting your day-to-day activities and also your work life. Some of the specialists who deal with pain include rheumatologists, neurologists, orthopedic surgeons, spine and neurosurgeons.